I am privileged and humbled to be invited for the second time by AVER conferences to keynote speak at their conferences. For that, I thank the AVER conferences management and Mr. Himan, the program director. Today, we're going to talk about the significance of clinical leadership, and hopefully you will enjoy my session. Himan, okay, there you go. Yeah. So leadership is a skill. It's not a position. Despite being leader for such a long time, very long period, each situation and each group of people, each team requires a different set of leadership skills and, of course, a different approach. This is why it's key for the leader to have a basket full of different leadership approaches to use when handling different situations and different teams. Leaders are effective when they are considered influential due to what they do rather than what position they hold. To be effective and influential, the leader needs to be capable of empowering their team, using creativity in communication, and that's to ensure the understanding and gain the support of their team. They need to be capable of successfully supporting the team and the patients and their families, to advocate them, in short. To be able to stimulate the interest for the staff to view work from different perspectives and new perspectives. To be able to develop higher levels of staff potential and abilities, and to motivate the team to look beyond their own interests, actually to look to the interests of the whole team. And by that, they will eliminate toxic work environments. Negativity is inversely proportional to work environment optimization. And to be an effective leader, the work environment needs to be optimal. Because what goes in comes out. So what's effective leadership in practical terms? It's to work alongside the team and help them develop into leaders themselves. Leaders to lead their own role and their own job. To role model, to inspire and transform others. Effective leadership is the ability to empower and constructively challenge and motivate the team. And it is to encourage the team to be creative, to find solutions. Here are some accomplished leaders who defined effective leadership. Let's hear what they said.
Who's held a few leadership positions. What would you say the number one leadership challenge you faced is?
I think that throughout my career, people have felt that I am nice and that I'm kind and that I am humble and quiet. And I think the challenge is to show people that the willow, because it bends, is far stronger than the oak or the evergreen because they blow over the wind. And that kindness and niceness is about as strong as any steel you're going to bang into.
We are talking lessons in leadership with someone who knows an awful lot about leadership. She is Dr. Maria Teresa Montiel, President of the Latino Leadership Alliance of New Jersey. Doctor, the number one leadership lesson you learned in your career would be?
It would be the definition of leadership. There are thousands of them, but mine is a leader is someone who's able to bring a group of people from one place to another place. And if you can do that with integrity all around, then you have yourself an effective and very leader.
Lesson in leadership with Dr. Mary, Vice President of Enrollment Management and Learner Services, Thomas Edison State University. You learned a
in higher education. What I can tell you from managing leaders themselves is that it's an ongoing thing. You need to practice it. It's not something that one masters. And even though I've been in it for 30 years, I've come to learn things as I go along. The most important thing for me is authenticity. What I found, the situation may change, the folks will change, but you need to be authentic in who you are as a leader, and obviously build upon all those leadership tools and skills that we acquire along the way.
Number one lesson in leadership you've learned so far?
Oh, have the skills, education, know what you're talking about, always be prepared, confidence, empower others.
In your few years as a hospital administrator, seeing a lot of changes, what's the number one leadership challenge you face?
Number one leadership challenge is stay humble, Steve.
I'm sorry, on that.
I think,
What we say?
we're tough administrators, we're tough executives. We can work 24 hours a day. We can do anything. But it's not about us. It's about our communities. It's about the people we work with. It's about the 32,000 employees at RWJ Barnabasel. It's about the communities we serve. It's not about us. So for the great opportunity that we have to serve, stay humble. It's not about us.
The greatest leadership lesson you've learned in the career so far?
I would say probably listening to the people I'm leading. I would say that you can't really be a leader unless you know the people that you're working with, and you have to be able to listen to them and adapt to what they need.
So as we see that leadership is not about the leaders themselves, it's about the people they work with and the community they serve. Oopsie. All leaders are faced with challenges. So the Center for Creative Leadership listed the top 6 leadership challenges around the world. It's owning effectivity or effectiveness, and for a reason or another, I can't see my screen. Okay, so it's owning effectiveness, inspiring others, developing the employees, and leading the team per se is a challenge, guiding change, and managing stakeholders. Healthcare leaders do face these challenges, but a bit more, or I may say a lot more challenges, because they lead within a complex setting of modern healthcare services. The needs are diverse and they keep on changing. The expectations are always high and they continue to increase, especially from the patient and the family. The pressure is the pressure of work, the pressure of time, it's the stress and the anxiety of the staff, the patients, and their families. It's the systems they work with, the policies that they need to follow, the cost control, and all other administrative aspects. The impact of clinical leadership on staff, on patients, and their families could be either good or poor. If it was a good leadership with a good impact, you see that the work environment is comfortable, staff performance is phenomenal, there's safe care delivered, there's great patient and family experience, and obviously optimum care outcomes. When those clinical leadership skills are poor, then the impact is definitely poor. And there is high stress, low staff morale, higher rates of incidents, poor patient experience, and increased work stress, workload, burnout, and there is a rise in the turnover. Healthcare, by fact, is demanding. Healthcare systems are very complex. So to function effectively as a leader and to function effectively as a healthcare facility, staff need to be comfortable working within the healthcare system and with the healthcare system. And that's for the benefit of the patient and their families. Now, whose responsibility is it to carve this comfort? It's the clinical leader's responsibility. It's a big one. So what is the significance of the role of clinical leaders? They need to consider and meet the needs of the patients and their families. They have to be proactive in planning to optimally utilize available resources, be it human resources, manpower, or non-human resources. They need to ensure the timely delivery of the right required care. And they need to implement clinically led service improvements, which is giving more autonomy to the clinical staff to make decisions. And that improves the quality and efficiency of the health services. It improves staff's objectivity and performance and improves care outcomes and hence patient experience. They also need to employ functional results-oriented model. If we all look at the bottom of the screen, you see to the left side of the image or the model, there's traditional functional leadership model, which involves the individual, which is the patient and their family in this case, the task itself, it's the intervention, the care rendered, the procedures done, and the team who are the staff. So that was the traditional model. Effective clinical leadership is required to move from the traditional functional leadership model to the results-oriented leadership model. So add results to the previous model. So the results are the ones that affect the individual, the procedures, and the team, hence the outcomes. So we need to add the factor of results. So I'm not doing a procedure to do it. I'm performing a procedure to get a specific result or outcome. I'm not working with a patient because I need to. I'm working with the patient because I want to deliver optimum care and I want the patient to receive the quality care and be comfortable and satisfied. And I want myself as a clinical staff, or I want my staff, me being the leader, to be comfortable and performing at their best. To be effective, the clinical leader is required to strive to do the right thing. They need to ensure that their team always does the right thing for the right patient. Not only that, but also go beyond that, looking for better ways to do things, different ways to do things. To be effective, the clinical leader needs to use intellectual stimulation, which is to stimulate innovative and creative thinking, to encourage the team to explore different ways, enhanced ways to get to solutions. And that can only happen if the team is empowered. Also, the effective clinical leader needs to practice individualized consideration, which is to create a diverse and supportive environment. And this can only happen by knowing each of the team members, acknowledging and respecting their differences, and also by listening to the concerns and needs, and not only listening, but acting on those concerns and needs. It is important and rather required that the clinical leader appreciates that values and beliefs and cultural differences have effects on performance, because everyone's behaviors are shaped by their cultural background, by their experiences, values. So to better understand cross-cultural issues, we as leaders, we as clinical leaders specifically, need to learn each employee's background. And not only that, we also need to learn and understand patients' background. we need to appreciate the diversely valuable inputs they bring into the workplace, the employees bring into the workplace. Because people have different expectations of how they like to be treated, how they like to be talked to, tonality, approach, and that is all based on their cultural backgrounds and their values. How is this done? Managing diversity requires skills and abilities. It's simply a competence. Effective leaders are required to work on enhancing their capabilities to manage the complexity of diverse people, because it's not easy. It's a complex issue. Understand and respect those differences. Look at similarities rather than differences. Communicate more effectively. Build those relationships to close that cultural gap, and hence adjust the leadership style accordingly, because there is not one leadership style that fits all. To be an effective clinical leader also requires exceptional caring values and emotional intelligence, specifically emotional reasoning. And what do I mean by emotional reasoning? I'll give you an example. If I'm a leader and I'm making decisions that impact and affect my staff, emotional reasoning is including those staff in the decision, not only just FYI informing them, including them in all decisions that impact their roles or affect their roles. Empathy is very important, so understanding own emotions and emotions of others, as well as the physical and emotional resilience and agility. It's all about being in control of yourself first and of the situation as a clinical leader. Because when staff, patients, and their families sense that the leader is in control, they know they are safe. Now, why do I have different glasses here in different cases? I just thought I'd use this example to explain more how patients feel safe when clinical leaders are in control and know what they're doing, and they are in control of the situations very effectively. So if we look at the top of the image, there's a hard case, and then next to it, there's the very soft case. So when we put those glasses in the hard case, they're protected. If we put them in the soft case, they're less protected. Chances for the lenses to break is definitely higher. So if I think of the leader as the hard case, or the case in general, if the leader was an effective clinical leader, then that leader is the hard case that protects the glasses. If the leader wasn't as effective, then that's what we compare to the soft case. Now, if you look at both glasses, one of them has frames and the other one does not have frame. In your opinion, which lenses are more protected? The ones with the hard frame or the frameless ones? The ones with the hard frame. So the lenses are the patient, and the frame is the clinical staff, and the case is the leader. So the lenses are more protected when they have frame, a hard frame, and when they are placed in the hard case. As an effective clinical leader, your aim is for your team to work hard. We all want our teams to work hard, but to work hard to achieve rather than work hard to burn out. So spark that performance by using the right leadership approach. To be satisfied, to stay focused, to be enthusiastic, efficient, productive, all depends on how comfortable one feels at work. because a pleasant working environment optimizes engagement and productivity. What are the key takeaways? To be an effective clinical leader, it is very important and key to lead from bottom up. So the leader is at the bottom, supporting the staff, empowering them, giving them all what they need, being there to solve their problems, to help them with stressful situations. And that would impact the performance of the staff and hence the care delivered and ultimately the care outcomes and patient satisfaction. The leader, to me, is the conductor, the orchestrator, who orchestrates all these different leadership styles and approaches and skills to have that beautiful symphony. So it is key for the clinical leader to have a basket full of various leadership skills and approaches to use in specific situations when working with specific people, because there is no one size fits all in leadership and specifically in clinical leadership. That's all for my session. I really hope you enjoyed it, and I trust that you will enjoy the rest of the conference. Thank you all for your attention.
Yeah,